RN Prometric Exam Collection. Questions 81 to 100. Part 5. 81. A preoperative client expresses anxiety to a nurse about upcoming surgery. Which response by the nurse is most likely to stimulate further discussion between the client and the nurse? 1. If it's any help, everyone is nervous before surgery. 2. I will be happy to explain the entire surgical procedure to you. 3. Can you share with me what you've been told about your surgery? 4. Let me tell you about the care you'll receive after surgery and the amount of pain you can anticipate. The answer is 3. Can you share with me what you've been told about your surgery? Rationale. Explanations should begin with the information that the client knows. By providing the client with individualized explanations of care and procedures, the nurse can assist the client in handling anxiety and fear for a smooth preoperative experience. Clients who are calm and emotionally prepared for surgery withstand anesthesia better and experience fewer postoperative complications. Options 1, 2, and 4 will produce anxiety in the client. 82. A nurse is conducting preoperative teaching with a client about the use of an incentive spirometer. The nurse should include which piece of information in discussions with the client? 1. Inhale as rapidly as possible. 2. Keep a loose seal between the lips and the mouthpiece. 3. After maximum inspiration, hold the breath for 15 seconds and exhale. 4. The best results are achieved when sitting up. The answer is 4. The best results are achieved when sitting up. Rationale. For optimal lung expansion with the incentive spirometer, the client should assume the semi-Fowler's or high Fowler's position. The mouthpiece should be covered completely and tightly while the client inhales slowly, with a constant flow through the unit. The breath should be held for 5 seconds before exhaling slowly. 83. A nurse has conducted preoperative teaching for a client scheduled for surgery in 1 week. The client has a history of arthritis and has been taking acetylsalicylic acid, aspirin. The nurse determines that the client needs additional teaching if the client states: 1. Aspirin can cause bleeding after surgery. 2. Aspirin can cause my ability to clot blood to be abnormal. 3. I need to continue to take the aspirin until the day of surgery. 4. I need to check with my physician about the need to stop the aspirin before the scheduled surgery. The answer is 3. I need to continue to take the aspirin until the day of surgery. Rationale. Anticoagulants alter normal clotting factors and increase the risk of bleeding after surgery. Aspirin has properties that can alter the clotting mechanism and should be discontinued at least 48 hours before surgery. However, the client should always check with his or her physician regarding when to stop taking the aspirin when a surgical procedure is scheduled. Options 1, 2, and 4 are accurate client statements. 84. A nurse assesses a client's surgical incision for signs of infection. Which finding by the nurse would be interpreted as a normal finding at the surgical site? 1. Red, hard skin. 2. Serous drainage. 3. Purulent drainage. 4. Warm, tender skin. The answer is 2. Serous drainage. Rationale. Serous drainage is an expected finding at a surgical site. The other options indicate signs of wound infection. Signs and symptoms of infection include warm, red, and tender skin around the incision. Purulent material may exit from drains or from separated wound edges. Infection may be caused by poor aseptic technique or a contaminated wound before surgical exploration, existing client. Conditions such as diabetes mellitus or immunocompromise may place the client at risk. Wound infection usually appears 3 to 6 days after surgery. The client also may have a fever and chills. 85. A nurse is monitoring the status of a postoperative client. The nurse would become most concerned with which of the following signs that could indicate an evolving complication? 1. Increasing restlessness. 2. A pulse of 86 beats/min. 3. Blood pressure of 110/70 mmHg. 4. Hypoactive bowel sounds in all four quadrants. The answer is 1. Increasing restlessness. Rationale: increasing restlessness is a sign that requires continuous and close monitoring because it could indicate a potential complication, such as hemorrhage, shock, or pulmonary embolism. Hypoactive bowel sounds heard in all four quadrants are a normal occurrence. A blood pressure of 110/70 mmHg with a pulse of 86 beats/min is within normal limits. 86. A nurse is reviewing a physician's prescription sheet for a preoperative client that states that the client must be NPO after midnight. The nurse would telephone the physician to clarify that which of the following medications should be given to the client and not withheld. 1. Prednisone. 2. Ferrous sulfate. 3. Cyclobenzaprine, Flexeril. 4. Conjugated estrogen, Premarin. The answer is 1. Prednisone. Rationale: prednisone is a corticosteroid. With prolonged use, corticosteroids cause adrenal atrophy, which reduces the ability of the body to withstand stress. When stress is severe, corticosteroids are essential to life. Before and during surgery, dosages may be increased temporarily. Ferrous sulfate is an oral iron preparation used to treat iron deficiency anemia. Cyclobenzaprine, Flexeril, is a skeletal muscle relaxant. Conjugated estrogen, Premarin, is an estrogen used for hormone replacement therapy in postmenopausal women. These last three medications may be withheld before surgery without undue effects on the client. 87. A client who has undergone pre-admission testing has had blood drawn for serum laboratory studies, including a complete blood count, coagulation studies, and electrolytes and creatinine levels. Which of the following laboratory results should be reported to the surgeon's office by the nurse, knowing that it could cause surgery to be postponed? 1. Sodium, 141 milliequivalent/L. 2. Hemoglobin, 8.0 g/dl. 3. Platelets, 210,000/mm3. 4. Serum creatinine, 0.8 mg per deciliter. The answer is 2. Hemoglobin, 8.0 g/dl. Rationale: routine screening tests include a complete blood count, serum electrolyte analysis, coagulation studies, and a serum creatinine test. The complete blood count includes the hemoglobin analysis. All these values are within normal range except the hemoglobin. If a client has a low hemoglobin level, the surgery likely could be postponed by the surgeon. 88. A nurse receives a telephone call from the post-anesthesia care unit stating that a client is being transferred to the surgical unit. The nurse plans to do which of the following first on arrival of the client? 1. Assess the patency of the airway. 2. Check tubes or drains for patency. 3. Check the dressing to assess for bleeding. 4. Assess the vital signs to compare with preoperative measurements. The answer is 1. Assess the patency of the airway. Rationale: the first action of the nurse is to assess the patency of the airway and respiratory function. If the airway is not patent, the nurse must take immediate measures for the survival of the client. The nurse then takes vital signs, followed by checking the dressing and the tubes or drains. Options 2, 3, and 4 are all nursing actions that should be performed after a patent airway has been established. 89. A client is being prepared for a thoracentesis. A nurse assists the client to which position for the procedure? 1. Lying in bed on the affected side. 2. Lying in bed on the unaffected side. 3. Sims position with the head of the bed flat. 4. Prone with the head turned to the side and supported by a pillow. The answer is 2. Lying in bed on the unaffected side. Rationale: To facilitate removal of fluid from the chest, the client is positioned sitting at the edge of the bed leaning over the bedside table, with the feet supported on a stool or lying in bed on the unaffected side with the head of the bed elevated 30 to 45 degrees. The prone and Sims positions are inappropriate positions for this procedure. 90. A nurse develops a plan of care for a client with deep vein thrombosis. Which client position or activity in the plan will be included? 1. Out-of-bed activities as desired. 2. Bed rest with the affected extremity kept flat. 3. Bed rest with elevation of the affected extremity. 4. Bed rest with the affected extremity in a dependent position. The answer is 3. Bed rest with elevation of the affected extremity. Rationale: for the client with deep vein thrombosis, elevation of the affected leg facilitates blood flow by the force of gravity and also decreases venous pressure, which in turn relieves edema and pain. Bed rest is indicated to prevent emboli and to prevent pressure fluctuations in the venous system that occur with walking. 91. The nurse is caring for a client who is 1 day postoperative for a total hip replacement. Which is the best position in which the nurse should place the client? 1. Side lying on the operative side. 2. On the no operative side with the legs abducted. 3. Side lying with the affected leg internally rotated. 4. Side lying with the affected leg externally rotated. The answer is 2. On the no operative side with the legs abducted. Rationale: positioning following a total hip replacement depends on the surgical techniques used, the method of implantation, the prosthesis, and physician's preference. Abduction is maintained when the client is in a supine position or positioned on the non-operative side. Internal and external rotation, adduction, or side lying on the operative side, unless specifically prescribed by the physician, is avoided. Options 1, 3, and 4 are incorrect positions for this client. 92. A nurse is preparing to remove a nasogastric tube from a client. The nurse should instruct the client to do which of the following just before the nurse removes the tube? 1. Exhale. 2. Inhale and exhale quickly. 3. Take and hold a deep breath. 4. Perform a Valsalva maneuver. The answer is 3. Take and hold a deep breath. Rationale: when the nurse removes a nasogastric tube, the client is instructed to take and hold a deep breath. This will close the epiglottis. This allows for easy withdrawal through the esophagus into the nose. The nurse removes the tube with one smooth, continuous pull. Therefore, options 1, 2, and 4 are incorrect. 93. A nurse is assessing for correct placement of a nasogastric tube. The nurse aspirates the stomach contents and checks the contents for pH. The nurse verifies correct tube placement if which pH value is noted. 1. 3.5. 2. 7.0. 3. 7.35. 4. 7.5. The answer is 1. 3.5. Rationale: if the nasogastric tube is in the stomach, the pH of the contents will be acidic. Gastric aspirates have acidic pH values and should be 3.5 or lower. Option 2 indicates a slightly acidic pH. Option 3 indicates a neutral pH. Option 4 indicates an alkaline pH. 94. A nurse is inserting a nasogastric tube in an adult client. During the procedure, the client begins to cough and has difficulty breathing. Which of the following is the appropriate nursing action? 1. Quickly insert the tube. 2. Notify the physician immediately. 3. Remove the tube and reinsert when the respiratory distress subsides. 4. Pull back on the tube and wait until the respiratory distress subsides. The answer is 4. Pull back on the tube and wait until the respiratory distress subsides. Rationale: during the insertion of a nasogastric tube, if the client experiences difficulty breathing or any respiratory distress, withdraw the tube slightly, stop the tube advancement, and wait until the distress subsides. Options 2 and 3 are unnecessary. Quickly inserting the tube is not an appropriate action because, in this situation, it may be likely that the tube has entered the bronchus. 95. A nurse is assisting a physician with the removal of a chest tube. The nurse should instruct the client to 1. Exhale slowly. 2. Stay very still. 3. Inhale and exhale quickly. 4. Perform the Valsalva maneuver. The answer is 4. Perform the Valsalva maneuver. Rationale: when the chest tube is removed, the client is asked to perform the Valsalva maneuver, take a deep breath, exhale, and bear down. The tube is quickly withdrawn, and an airtight dressing is taped in place. An alternative instruction is to ask the client to take a deep breath and hold the breath while the tube is removed. Options 1, 2, and 3 are incorrect client instructions. 96. While changing the tapes on a tracheostomy tube, the client coughs and the tube is dislodged. The initial nursing action is to 1. Call the physician to reinsert the tube. 2. Grasp the retention sutures to spread the opening. 3. Call the respiratory therapy department to reinsert the tracheotomy. 4. Cover the tracheostomy site with a sterile dressing to prevent infection. The answer is 2. Grasp the retention sutures to spread the opening. Rationale: if the tube is dislodged accidentally, the initial nursing action is to grasp the retention sutures and spread the opening. If agency policy permits, the nurse then attempts immediately to replace the tube. Covering the tracheostomy site will block the airway. Options 1 and 3 will delay treatment in this emergency situation. 97. A nurse is caring for a client immediately after removal of the endotracheal tube. The nurse reports which of the following signs immediately if experienced by the client. 1. Stridor. 2. Occasional pink-tinged sputum. 3. Respiratory rate of 24 breaths/min. 4. A few basilar lung crackles on the right. The answer is 1. Stridor. Rationale: following removal of the endotracheal tube, the nurse monitors the client for respiratory distress. The nurse reports the stridor to the physician immediately. This is a high-pitched, coarse sound that is heard with the stethoscope over the trachea. Stridor indicates airway edema and places the client at risk for airway obstruction. Options 2, 3, and 4 are not signs that require immediate notification of the physician. 98. The nurse checks for residual before administering a bolus tube feeding to a client with a nasogastric tube and obtains a residual amount of 150 milliliters. What is the appropriate action for the nurse to take? 1. Hold the feeding. 2. Rein still the amount and continue with administering the feeding. 3. Elevate the client's head at least 45 degrees and administer the feeding. 4. Discard the residual amount and proceed with administering the feeding. The answer is 1. Hold the feeding. Rationale: unless specifically indicated, residual amounts more than 100 milliliters require holding the feeding. Therefore, options 2, 3, and 4 are incorrect. Additionally, the feeding is not discarded unless its contents are abnormal in color or characteristics. 99. A nurse caring for a client with a pneumothorax and who has had a chest tube inserted notes continuous gentle bubbling in the suction control chamber. What action is appropriate? 1. Do nothing, because this is an expected finding. 2. Immediately clamp the chest tube and notify the physician. 3. Check for an air leak, because the bubbling should be intermittent. 4. Increase the suction pressure so that the bubbling becomes vigorous. The answer is 1. Do nothing, because this is an expected finding. Rationale: continuous gentle bubbling should be noted in the suction control chamber. Option 2 is incorrect. Chest tubes should only be clamped to check for an air leak or when changing drainage devices, according to agency policy. Option 3 is incorrect. Bubbling should be continuous in the suction control chamber and not intermittent. Option 4 is incorrect, because bubbling should be gentle. Increasing the suction pressure only increases the rate of evaporation of water in the drainage system. 100. A nurse is providing instructions to a pregnant client with human immunodeficiency virus, HIV, infection regarding care to the newborn infant after delivery. The client asks the nurse about the feeding options that are available. The best response by the nurse is: 1. You will need to bottle feed the newborn infant. 2. You will need to feed the newborn infant by nasogastric tube feeding. 3. You will be able to breastfeed for 6 months and then will need to switch to bottle feeding. 4. You will be able to breastfeed for 9 months and then will need to switch to bottle feeding. The answer is 1. You will need to bottle feed the newborn infant. Rationale: perinatal transmission of human immunodeficiency virus, HIV, can occur during the antepartum period, during labor and birth, or in the postpartum period if the mother is breastfeeding. Clients who have HIV are advised not to breastfeed. There is no physiological reason why the newborn needs to be fed by nasogastric tube.